Our studio audience control the direction of our discussion. They step up to the mic for an Ask Anything about an assortment of healthcare issues. Tonight, On Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. We are at the wonderful South Dakota Public Broadcasting Rapid City studio. We have a great audience and they will help us guide our discussion tonight. Thank you, audience, for being here. First, let's take a look at this week's Prairie Doc quiz question. In the last 3 years, how many long-term care facilities in South Dakota have had to close their doors due to a lack of reimbursement by Medicaid? We'll have the answer at the end of the show. Joining us tonight are Dr. Kevin Weiland of Rapid City Medical Center, practicing internal medicine, and Dr. Joy Falkenburg, Regional Health Medical Clinic, practicing family medicine in Custer, South Dakota. Thank you both for joining us.
Absolutely.
Thanks.
So it's a joy to have you, just your ambience, an internist, family physician. And so I would start before we get into questions, and we have wonderful questions from the audience. What is it that brought you to medicine, and what is the part that gives you the most feedback? Joy?
Tragedy brought me to medicine. I was pre-nursing, and then I had a bad incident with my mom, and didn't like the way that happened or how she was cared for, and so I went and applied for medical school. And what is created for me is a healing process, but also I get to share in lifelong goals and expectations and fun parts. Yeah, and sometimes sad things in families, but I've now been in Custer for almost 20 years. So my first baby that I delivered actually ran her senior high school cross-country meet with my girls. So I've had a great career. I'm only 45, but I've had a great long career.
Well, the same question to you, Kevin.
You know, my father, he was a mortician. I grew up in the mortuary business, and I saw a lot of the end-of-life stuff.
In Madison, South Dakota.
Madison, South Dakota, yeah, just down the street from you. And, you know, seeing what the end of life was like and seeing actually the end result when we see this obesity epidemic and so much is so preventable. The smoking epidemic back in my father's day killed my father at age 55 at a going away party for me. I did CPR on my father, brought him to the hospital, and he died. I was going to go to paramedic school. I eventually went there and then went on to medicine because I really felt this kind of passion to prevent. And, you know, so I take advantage of that, and I really try to, you know, stick to those guns and trying to prevent disease with my patients.
Yeah. My hero was Dr. Bell from D. Smith.
Robert Bell.
Robert.
Know him well.
G. Robert Bell.
Yes.
And his family were dear friends of our family. And I can remember sitting around a campfire at Spirit Lake, South Dakota, not Spirit Lake, Iowa, and singing songs and loving the family unity. And he was like that throughout the town. And for, I think, 20 years, it was 24/7 because he was all alone in that town.
That's very cool, and it also highlights like why it's so important to have mentorship.
Yep.
You gotta have doctors out there that are attracting other doctors and saying that this is a noble field. Other people should come into it and join us.
And to honor Dr. Bell, he was my wife's mentor as well.
Really?
So,
There you go.
We got married at his cabin out here in the Black Hills.
Oh, you did?
Yes.
I didn't know that.
Yeah.
So this is a great beginning, but we should talk about the questions that the audience has asked us. And I think the more we can, if we disagree, let's have the controversy. Okay? If you are aware of a person with mental illness and that person has made threats of bodily harm on Facebook but has not actually performed that harm, is there a way to force that person into a mental illness facility? Ooh, that's a question.
How can you force, but you can direct? I do have them go to the emergency room, and when they're in the outpatient setting. So I think that's an appropriate way to handle them.
Yeah, and if it's a situation where they've actually posted something about self-harm or injury to other people.
Or injury to you.
Or injury to you, you can call law enforcement. Law enforcement will pull up their Facebook page and they'll actually go knock on their door. try to help.
That's a tough question.
Yeah.
It is.
All right, thank you for that question. Many would say that spiritually, love is the greatest word. In medicine, what word comes to your mind that is the key to healing? Joy?
Unconditional love and kindness. And I think if you take people in their brokenness and you just love them without judgment and try to help guide them, that's true healing.
Kevin?
I think one of my mentors said this out here, that patients don't care how much you know until they know how much you care. And if you show them how much you care, they will bend over backwards to quit smoking or to change their lifestyle, to run, exercise, eat less, et cetera, et cetera. But they care, and they don't want to disappoint you. And I really found that is really, really powerful.
I totally agree. I think maybe they say this is placebo effect, but as a physician, when they knew I cared, they got better.
Yeah.
I mean, it's a real healing thing.
Mm-hmm.
And I don't know, I don't think that that's placebo effect. I think it's a spiritual thing. Yeah, although I'd add to your comment about spiritual love, I remember looking at my kid and saying to him, one of our 4 children, you know I love you unconditionally, but I'm not liking what you're doing right now.
Yeah.
And so
Your mom might have said something similar.
I've
at
heard
some
that
point.
myself, I think is what happened to me. But I think right now the country is in a spiritual disharmony. And I know that there is a lot of hate thrown around. I think we should not hate because it destroys us more than it does
Right.
anybody else.
Right.
We can hate what they're doing though. And I think that's the key. We need to love our enemies and maybe hate what they're doing if they're doing something wrong.
Right.
Nice question. What are your insights concerning so many young people attempting self-harm and suicide?
Oh. Yeah, I got to say, I'm glad I'm an internist because I am a doctor for adults. I don't know how you do it. I really don't. I don't think, it's a tragedy.
It's amazing right now. I think it's childhood trauma. I think that a lot of it goes down to negligent childhoods. It doesn't even always have to be abusive childhoods. Sometimes it's abusive. There's a lot of abuse and neglect that go on in childhood homes. But I think the other thing is just a lack of attention. I think that the lack of intention in parenting is a real crisis. And I think that it's ending up in damaged children.
It's a spiritual crisis in America, along with the suicide rates climbing throughout the country, and especially in South Dakota.
Right.
There's the epidemic of opioid deaths, suffocating.
Don't you think that social media plays a role in this too, where they have a lot of studies on this where they're more connected than ever, but more lonely than they've ever been. There's not really an intimate connection with friends and kin and family members, and they're very lonely.
Yeah, well, we used to play outside, throw snowballs at each other, and wrestle, but they're sitting in front of a computer most of the time. There's not any touch.
Right.
What are your insights concerning so many young? Oh, that was asked. What's the deal with ranitidine recall? Should I stop taking my medicine, and what is the risk to continue to take it? Really good question.
Yeah.
Well, I haven't had that opportunity to recall anyone yet. I mean, it is over the counter, and I just haven't had that many patients on it.
I think that in general, I think they're going to say that this isn't, I guess I didn't look into ranitidine specifically. I was thinking about losartan, and we have all kinds of questions on that too. But it's a question of where they're being manufactured too. It's not just necessarily the medication. And I wonder if we're not going to see more and more of that as maybe things are made in various places that aren't as well regulated.
Yeah,
Right.
I think losartan is in China. And
Yeah.
some carcinogen contaminants, and that's what they recalled that one.
We just had a patient that we were struggling with getting his inflammatory bowel disease under control, and each time he came into the ER, it's like, what is happening with this? Well, because he's getting his prednisone from Mexico. We're just right. Who knows how much it is, right? Maybe it's 40 milligrams, maybe it's 10, maybe it's 40 and then 10. Who knows? So there's good and bad. I mean, I get it. It's an affordability crisis, right?
Well, I mean, how can you afford? I mean, I I take a pancreatic enzyme, right?
Yeah.
We used to prescribe pancreatic enzyme, and it was $30 a month supply.
Right.
You know, and that was a little expensive, but $30 was okay. Now, for a month supply of pancreatic enzyme, it's $800.
Right.
And my insurance company covers all but $400.
Isn't that incredible?
And so what I'm doing is I'm getting a month supply in Canada.
Yeah.
I
Yeah.
hate to say it, but I've gone to Canada, planetdrugs.com.
Maybe Canada more than Mexico.
Have you tried the GoodRx card though?
Yeah, that is helpful.
Yeah, that is helpful. Yeah.
The
I give it to my
GoodRx,
patients.
explain
Yeah.
that to me.
It's a service that it's an app for the phone,
Right.
and you type in a GoodRx, get the app, type in a drug, and they'll find the best deal in the local area, and they'll give you a coupon sometimes to get a drug discount.
GoodRx.com.
GoodRx.com.
And it's also not helpful that we used to be able to give some sampling, but anything that we can do for people that would be helpful through the pharmaceutical companies cannot be used in Medicare-age patients, typically.
Right.
Because once you receive Medicare Part D, you can't receive coupons. So and just trying to figure it out is honestly exhausting, trying to figure out, like, I know what medicine I want to give you. What medicine am I able to give you?
Yeah. I'll give the story of Narcan. Of course, because 72,000 people are suffocating a year. I mean, that in comparison to car crashes is 35,000. Diabetes is 86,000.
Right.
72,000 are dying every year right now. I mean, 70,000 last year. So every good ambulance is going to have Narcan available, right?
Now it's
did as a
available to
paramedic
people.
in Chicago.
Yeah.
Yeah, $5
Right there. Yep.
50 cents to $5 worth of ingredient. And they raised the price of a 2-injector thing to $4,000.
Right. To save a life.
Yeah. So who's over the barrel? Well,
Right.
we have to buy the daggone $4,000 thing. Although the company who made that $4,000 syringe is now dropping the price to $300 for the $5 worth of. We need to call the pharmaceutical industry on their unethical behavior.
Pricing, yeah, that's right.
You know,
That's
you
right.
you have patients on prescription drugs, opioids, and so do I, and you probably do too. They all get Narcan. They all get it, and I don't care. I write the script. It's their responsibility, unfortunately, to get it. It's not health care. It's health control. It's the industry that's controlling it, and that really bothers me a lot because we didn't go in for that reason.
No, right.
I mean,
right.
we did not go in for that reason.
No.
So.
No, as hospice director, I prescribe plenty of
Yeah.
opioids, no question about
Yeah,
it.
you have to.
It's a great drug,
Yeah.
and it's the worst of times and the best of times.
And I have used Narcan several times as a paramedic in Chicago. That stuff works.
Yeah.
It is amazing.
Yeah.
Then they're going crazy and in pain in the ambulance, but by the time we get to the emergency room, we dump them off and we're out of there.
I had a gentleman in the ER at Grady Hospital when I was an intern, and he was out. He was just gone, just barely alive,
Yeah.
barely breathing. Big 250-pound, 6'5" guy from the streets, and I gave him the Narcan, and he woke up and wanted to choke me because I took his high away. I'll never forget that moment.
If you haven't heard, there's a podcast, and it's really a great podcast on the Lazarus drug. And it talks about how what you would expect with the giving of Narcan to family members and using it is that deaths would drop precipitously. Mm-hmm. But they didn't actually. And if you look at some of the data, they've gone up because people are pushing the limits harder than they would have before and dying because they think that they'll have a
They've got
reversal.
the rescue.
They think they had and they don't.
That's a good point.
So it's kind of an interesting epidemic.
Yeah.
Even though we live and have learned in South Dakota's environment, we are still exposed to injury, even if we think we've done everything properly.
I've grown up in South Dakota, but I never realized that 25-degree weather and no wind, you could still get frostbite. I was wearing 2 pairs of pants and a pair of leggings, so I was dressed warmly, I thought. I was on the ice directly on my knees, but I thought, I didn't really think that that was a problem. So then when I got in the house, I started to have this unbelievable pain on my knees, and that's when I first noticed it. And I looked at my knees, and it looked like it was a black scab over all my knees. probably about 2 to 3 inches long. When the doctor came in, she said, "Oh my gosh, you have a really bad case of frostbite." And I never would have dreamed in a million years that was frostbite. I didn't go to the doctor the next day, but I went the following day. The reason I went in was because of the pain. I still never thought it was frostbite. I thought it was just very badly bruised. The treatment was kind of in 2 separate processes. There was dressing, and then there was the medication that I had to take. I had to dress both my knees every day in the morning and in the evening, and it would take about 30 to 45 minutes to do it. So they gave me hydrocodone and gabapentin for the nerve pain. And as the months went by, it kind of went down to maybe a 5 or a 7. And then I didn't take the hydrocodone anymore. I took gabapentin, which is a nerve medication. One of the surprising things about it was how long it took to heal. Because just now in September, I just have scarring, but it really took until that time for the black portion to go away, which was, the doctors told me the black part that looked like a scab was my skin, but they said it was really just very deeply burned in those portions. It's very possible that I might have nerve damage going forward, not severe. Now how I would describe it would be sometimes at night, like I said, it's more feeling of electricity or kind of a pain, but it's not 24 hours a day like it was before. So I would say it's on a scale of 1 to 2 when I have it, but it's not all the time. And on top of my knees, though, it does hurt all the time. It does hurt. And it kind of makes me think about children. I know we used to play and make forts in the snow at recess when I was little. And I guess, we didn't really think about it, but that's another thing to be more careful about.
Well, we appreciate that story about frostbite. Have you had patients with frostbite?
I have. It was a rough winter last year, and these farmers are out there trying to take care of their cattle. It's sub-zero weather, and they're diabetics or pre-diabetics, and they have neuropathy whether they like it or not. They have vascular disease whether they like it or not, and it's real sad. I really warn them this year is that you have to protect yourself. You have to stay out of the elements, and maybe sacrifice the cattle because you cannot.
You can't do it.
You can't do it.
Sacrifice the cattle.
I know.
You clearly are not from a ranch. I work in the ER, so usually my frostbite is from intoxication. So
Yeah.
I would encourage the young people to think before they go to the bar, like,
Good point.
how are you getting home? And just kind of come out intoxicated and think that it's not as cold as it is and die or get
Right,
really bad
right.
frostbite.
Yep.
I had a case of a guy who was driving home drunk, and the police started chasing him, and he drove his car as fast as he could until he couldn't drive, and then he hit the ditch by accident. Got out of the car and ran into the snow behind trees and hid, and they couldn't
Right.
find him
Right?
until finally they got him and they brought him in, and he lost fingers and part of his face, and it was a frostbite at the worst that I've seen. Here's a question. Drug companies are prohibited from giving gifts to physicians, pens, stethoscopes, trips, but don't they have more influence on docs by the direct advertising to patients on TV?
Oh, yeah.
Wow.
Definitely.
Yeah, definitely a problem,
Yeah.
isn't it?
Oh, yeah. Yep. Yep.
I think it's hard because we have 15 to 30 minutes at most with a patient, and if 10 to 12 minutes of that is spent undoing the preconceived notions that they came in with, that's just not really the best use of their time. Mm-hmm. So it's one thing for a patient. I think patients should be engaged in shared medical decision making.
Yes.
They should say, hey doc, what do you think about this? That's totally fine. But if I say, not the right med, I don't really want to go clear through med school telling them why one way or the other, because if I do, that's okay, but then that's the only thing we're going to get to that day.
Right. And you're not going to be able to address the problem.
Yeah, it may not be the most important part.
And I get that GoodRx app out and I show them, this is the drug that's being advertised. This is the cost per month.
And that's great.
And this is what your insurance is not going to pay for it. They're in control. They're not going to pay for it. This is an alternative drug. This is the generic drug. This is, dimes to the hundreds of dollars.
And just as good.
And just as
equivalent.
good.
Or
yeah.
maybe even
and longer studied and safer.
Right. What is the relationship between malnutrition and health issues for young children, especially for children living in poverty? That's a great question.
Yeah.
Malnutrition, health issues, young children. Joy?
Yeah. So I have to say that in Custer, we have the privilege of not seeing very much of that. If we do, it's usually on a neglect basis. But we're close enough to Pine Ridge, and I grew up down in that area, that we see it pretty often. I think that there's like straight up malnutrition where the children aren't getting even enough calories. And actually, I see that not very often, but occasionally in a mom who's been like shamed into breastfeeding and they don't have enough milk for their baby. And I can show them on the curve, like your baby's not getting enough calories, and still they feel like somehow inadequate if they don't, solidly breastfeed. Even after lactation and stuff, some women just do not have enough breast milk. But on the other hand, we have a whole level of children that aren't even being paid attention to and given food to eat. They're scrounging up whatever's in the kitchen. And of course, that's going to be something that's very low in nutrition and very high in calories. Then we have a whole nother generation that's just eating junk food, everything. Right. And that's also just like wasteland of calories. It doesn't have any nutrition. I don't think the kids actually understand nutrition. And I don't honestly think that we have a lot of nutrition classes in high school or grade school, so they don't have the basis for it as they grow into adulthood.
And you remember everyone says, what kind of nutrition classes did you get in med school? I go,
oh, agree.
Why would we even want to get nutrition class in med school? We should be getting them in grade school.
Yeah.
It should be no child left with a big behind. They should be in there.
I like that.
They should be in there and learning nutrition at that age. Now, I'm an adult doctor. I take care of the childhood obesity kids right now that they're adults, and it's really a shame. It really is a shame. The bariatric surgeons are doing very well with these 20s and 30-somethings where we could address childhood obesity way before that.
So one of the ways we have tried to address that in Custer is that when we built a new hospital, we built a garden with it. It has 5 raised beds, and we want to teach kids, like, this is how you put a carrot seed in the soil. This is a carrot that then we bring them back and we're like, look, carrots are ready, We're going to boil carrots and eat carrots, and they're the carrots you grew, 65 days ago. That gets kids interested.
More interested.
When they can put their hands in there and pull the food out, the radishes and the carrots and the basil, that's how you get kids intrigued in that.
Well, unfortunately, though, they learn that the best food is pizza at the gas station.
It's pretty good in Casey's and
I
Vermilion.
have to admit, I am one.
I lived on that in med school. But, food is cheap there.
Yeah.
What's expensive is that carrot.
Yeah.
Yeah.
Yep.
Well, it's a lot of time and effort, right?
It's not just time and effort. If you want to get anything
in the
healthy,
store
it's
too,
expensive.
It is a difficult issue to talk people into or push them in the direction of, and if it weren't for my wife, I'd be eating more crap and less vegetables, and so it's been a good thing that I have a nutrition-oriented.
Again,
Joni
intentional
Holm.
parenting.
Yeah.
Intentional parenting.
Intentional parenting. That's
Through
and I was a
Joni and
student.
through the children.
Oh, yeah.
Yeah.
So, what are your thoughts about Medicare for all, Kevin?
What's the freedom of health care to be free from health control? I don't think that's a bad thing. I really don't. I think when people have insurance for one, whether it's Medicare for all or some other public option, I do feel that that they're going to get their nutrition addressed. They're going to get their hypertension addressed way before they ever go to the emergency room where they're having their first stroke or heart attack. So I can see the healthcare savings, not to mention the productivity of a healthy patient producing in society and taking care of their family. See, we take care of so many people to take care of you, to take care of the roads, to take care of the garbage, so I can drive safely to work, so that I can come back and take care of some other people. I mean, it's a big circle, and I think it would really provide a lot of freedom for people, a lot of freedom.
Get them a primary care provider for everyone. Yeah. Joy, what is your
I'm individualistic, right? So I grew up on a ranch and fiercely independent. And have you seen something that the government does really well?
one can argue.
Right. So I would point to the Veterans Administration and Indian Health Services and say, I'm not sure we're ready to go there, folks, yet.
So what would you do?
You know, I think it's complex, and it doesn't just, there's just probably not a one size fits all. There needs to be, somehow we got to cut the middle out of the fat of the insurance companies and people that are making a lot of money. I think that, I know my patients in Custer, I'm sure your patients in Rapid know that you're going to do what's in their best interest. But we have a whole industry now that is built on fear, right? Get this test because you need to be scared. Get this test because you need to be scared. Do you want this like procedure? What would you like to have done? And it's just perpetuating healthcare costs. And so if we cut out some of the ridiculousness in healthcare, it would save a lot of money. And one of the ridiculousnesses of healthcare is at the end of life. How much are we going to spend on the last 10 to 20 days of life because nobody will sit down and have a conversation and just say, like, I know this has to be a really difficult time for you. Let me spend some time with you and explain to you exactly what's going on.
We do spend like 90% of the end-of-life healthcare
Yeah.
dollars in the last 6 months of life. I
we
totally agree
could
with
do
that.
a lot better.
We could do a lot better. We do spend a lot of money in this country. We do spend a lot of money, and it's just not directed in the right way. There's too much health control. And I think the VA has some pitfalls, but they have some great things. My wife works there, and you know, I think IHS is underfunded. And
If they were funded correctly,
if they were
they
funded
could-
correctly, people that have insurance are doing okay. Everyone should have that opportunity. No one should be deprived. of it.
Everybody should have health care.
Everyone should be.
I like
They
the
should have a
idea.
living wage to do it.
Yeah. My personal opinion is not Medicare for all because it's going to be so controversial, it'll tie them all up in Washington. I think we should add a public plan. There should be a public plan for everybody. Let the insurances do
Fight it
their
out.
thing.
I agree.
Let them compete.
Yep.
And I think we could actually get that thing done. So I'm in favor of a public health plan that's available to all.
And just remember, people with insurance put the doctor at less risk. You know, if you don't have insurance, you're on a cafeteria plan when you go see a doctor for some reason. That you're not going to do that test because they won't pay for it. You're not going to do this because they're not going to pay for it. They put their family at risk when they think they have to pay for it. Then they go bankrupt, and the whole system is at risk. So everyone needs health insurance.
It's a complex
It's not-
problem.
If you get hurt, it's when you get hurt. It's not if you get sick. It's when you get
It's when
sick.
you get sick. It's not if you're going to die one day.
It's
Oh,
you're
yeah.
gonna die.
That's 100%.
You
Yeah.
got that one.
Yep.
So I thought we had controversy here, didn't we? That's always good. We like to have a little disagreement here and there. We don't always agree.
But we all agree everyone should have health insurance.
Everybody should have-
And so if that's our goal, let's find a
Let's
goal
get
and
there.
let's get there
Yeah.
in a very
the i-
bipartisan way.
And I like the idea that everybody has a doctor or a nurse practitioner or PA that is theirs, that gets to know them, that gets to care for them, and that can advise them, and that you don't start out with a specialist. You start
Oh,
with
yes,
your primary
yeah.
care doc.
Yeah.
The new shingles shot, what's the difference? Do we need new if we had old that worked?
Yes.
Yeah, you
Is it
do.
available?
No.
Have heard it's in short supply.
Yes, that was an easy one.
Yeah, it's not available.
Not available, but
Is
it's
it better?
Yes, it's a recombinant DNA technology, so it's not even, it's a fragment of the shingles. It's a part of the DNA.
It's not live.
It's not live, and it's very safe.
It's
Yeah.
very safe.
Yeah, well, except for I got a little sick with mine, but you're too young.
Well, the new one hurts. I mean, it makes you actually feel sick,
got
and I think
sick.
that we definitely need to tell people, like, you're not going to feel well with this.
Right.
If you're going on a trip, maybe best if you do it after the
Right.
trip, because right, it
got
builds
sick.
credibility to be
I had to
like.
go to work that day.
But the benefit is you don't get shingles that like you lose your eye to.
Right.
I don't know. Somebody today said, "So you have this at Custer?" I'm like, "Well, we do. The problem is that like we can't get secondary insurances to pay for it." So the answer is yes, we have it. This is what it'll cost you.
Which is what, 250
Yeah,
for
it's
each
like-
shot?
yeah.
And there's 2 shots or 3 shots?
two shots.
And anyone can get it. It's not a live virus. So if you're on
That's right.
biologics for rheumatoid arthritis or chemotherapy, they all recommend you get it.
Yeah, the people we told before, like you shouldn't have this, should now.
And if you get a diagnosis of MS, they want you to get it before you start any treatment.
All right. Talked about the effects of CBD oil on prescription medication. Ooh. CBD is marijuana.
Sticky wicket
No,
there.
it's not.
Well, okay. It is
It is not marijuana.
a congener. It is
It's an oil.
okay.
From the hemp, I believe.
Without the THC.
Without the THC.
But there's several different kinds of hemp, too. I mean, it's a complicated...
It's not regulated,
Well,
right? Like
Yeah,
this
and
is part of the issue.
really-
Is it's not
and it's not
regulated.
legal in South Dakota.
It's not
Yeah.
legal in South Dakota.
But, so what
You
would
can get it
s-
online.
You can get it online and mail it to you.
Right.
Yeah.
CBD oil.
Yep.
I think that it's like the guys that used to come around with the snake oils, right? Like, or the rain dancers that would dance and you paid them a lot of money and maybe they'd make it rain. So CBD oil is like good for everything, right? You can take it if you have this and take it if you have that. Now it's probably got some benefits,
And if a patient says that they feel better
Right.
with it, what are you going to tell them?
right?
Yeah,
And-
I think it's very safe. But I'm going to say, hey, yeah, keep doing it.
I
I'll
would-
take away that Percocet prescription
Yeah,
for you.
I would have
You
to
don't
agree
need
with
that
Kevin.
anymore.
Yeah, I totally agree.
Awesome, you're doing this now. This is way safer. So I think there might be a market for that kind of thing. I think it's okay.
70,000 people are dying every year of opioids,
Exactly.
which is available like crazy.
Yeah.
This is an alternative for pain that has been scientifically proven to be effective in certain cases. I mean, not in everybody.
Right.
So my
Patients.
sense is, why not make it available in the state?
So pain's a complex issue, right? I mean, meditation and placebo, nocebo are also effective.
Right.
And yet we don't do anything to really sit people down and say, like, Mayo Clinic has a program, you know, there's probably other programs available, but go through a program to say, what are we going to do about your pain as a whole entity? And probably CBD oil has a role in that. There's a lot of other things that have a role in it, one of them being meditation.
All right. Knowledge is one of the keys to successful treatment. Sharing that knowledge among the various medical groups lead to more effective care for us all.
The South Dakota Foundation for Medical Care has been a federally designated quality improvement organization and peer review organization since 1973. So we partner with the Centers for Medicare and Medicaid to evaluate the quality of care for Medicare beneficiaries in our state. The projects that we're currently working on, CMS, the Centers for Medicare and Medicaid, have tasked us with doing an environmental scan and really looking at some data that's already been gathered in our state related to opioids and chronic kidney disease. So we are looking at mostly what is some of the opioid death rates, or what might be some opioid adverse drug events that are happening. How is blood pressure managed in those who have been diagnosed with chronic kidney disease? Or how do we look at the diabetes population and see if there's been some new diagnoses of chronic kidney disease, and really kind of unique to South Dakota, such as our ruralness, and how does that affect the data that we have? How do we share our data across the state? How are healthcare systems able to talk to each other? What are some of the methodologies that they might use for collecting data? Really innovative ways that we can initiate some quality improvement measures. And then how do we evaluate that, really looking at the data that we gather through that? So CMS really has us work under the triple aim, and the triple aim is better health care, and lower costs. So as we gather all that data, we are able to report that back, and we're able to analyze that and see, did we improve the health care of certain populations in the state? Did we improve the health of the populations or individuals or Medicare beneficiaries? And also, did we do that in an effective way that we are lowering the overall cost of healthcare for our state? Some of our best successes have been, for instance, we've worked with clinics in evaluating the colorectal cancer screening practices. And so we've worked with them specifically to identify their data and see where they may have some gaps in their screening, and then help them to set goals that are aligned with the national strategy of the 80% by 2018. 27 emergency medical services squads in a certain district in our state, and taught them about sepsis and the importance of identifying sepsis very quickly. And we saw a 47% relative improvement rate in the deaths that occurred as a result of sepsis or septic shock. So we're going to be working in the nursing homes, also going to be working with community coalitions. So identifying those stakeholders in the community who really have an interest in some of these broad aims as well. And we know that when we partner with those stakeholders, we can see better improvement and we can reach more people. So that's really important. And then we'll also be working directly with the clinics and with providers.
Well, we appreciate the South Dakota Foundation for Medical Care. What a wonderful group, and they're our watchdog looking for quality, and we thank you for that. We have a comment from the audience. CBD is legal in South Dakota for 2 diagnoses. Both are seizure disorders, and the FDA approved last fall this for children. And so we appreciate that. We think that I really believe that there is a need for CBD and the like to be available and not at an unreasonable cost.
Right.
And then there was another question, this is related. Tell me about the real concerns of vaping. Any opinions?
Huge,
Yeah, right.
huge. What a mistake.
I tell my young people, like, would you fill a house with smoke and go in there and sit?
Would you go swim in a bath of oil and suck it into your lungs?
Yeah, right? I mean, if you asked them to do that, they wouldn't do that. They'd look at it and be like, that's dangerous. There's something in me that says that's not right.
And, and it's delivered through a real oily substance, and there's a whole ICD-10 code for
Oil inhalation
right
for
and,
aspiration mineral oils for people who are
Very
having
good.
problems with constipation.
and it has,
I'm an internist.
I know, it's awesome.
Isn't it kind of irritating, too, how this targeted, I mean, clearly we know what a jewel looks like, right? And we know who's going to be interested in those. I mean, you probably didn't see one at a gas station and think, I need one of those. But my kids are, 15 and 13 and 12, and, they're pretty. They're pretty just like their jewelry is
They're
pretty.
sexy,
Yeah.
they smell good.
Right. They're clearly targeting tweens, teens,
And it doesn't smell like they're smoking marijuana.
Right.
Nope.
How did we get away with the fact that the Camel was not okay, but the Jewel is okay? What the heck is the difference?
Oh, I think that it doesn't
Joe
have...
Campbell you're talking about.
It
Yeah.
doesn't
From the
ha-
90s.
It doesn't have the breakdown products of smoke, of
has-
the burning,
It has nicotine in it.
And
but
a
it does
lot.
have nicotine,
And a
I
lot
understand
of
that.
nicotine.
But it's better than smoking Camels.
It's not better than to get these kids addicted, and
No.
your brain is changing. And
Yeah, I agree.
We all know that.
So you both agreed that it's not a good thing to have bubblegum flavored nicotine vaping. But what about the epidemic or the 400 people that have been very sick from something out there with vaping? Do you know anything about
I
that?
do. I think the AMA just made a statement on that. It was laced or some different type of THC or marijuana product that were in these vapes when they did it.
Yeah, I think it's contraband,
Right.
a vape.
Right.
And so they've been putting in,
Yep.
oil from their kitchen or something else.
Just terrible.
It's no different than I tell people with anything else. Like if you vape for a reason. You vape because you need the stimulation, which then you should get a healthier lifestyle, so you don't. It's a drug. And if you're a kid vaping, you're sending a signal. I'm a badass, or I can do this because my parents tell me not to, or something. So what
Rebel.
signal are you sending, and why are you sending it?
Okay, good. This is a very interesting question. Do you have to be crazy to be creative?
Go, girl!
I'm not very artistic. I'm just crazy. I think right, there are a lot of artists that suffer from actual legitimate, and I don't like to call it crazy,
Van Gogh.
bipolar,
Bipolar
mania.
problems,
Yeah.
right? I think it's real.
Right, it's real. Like sometimes you can create your best work through suffering, right? So if you're suffering, then you can be more artistic sometimes too, or you can get a block. But I don't think all creativeness comes from crazy. No.
So if you look at it, that's interesting. I've been thinking about this for a while because I was reading comments by, what's the name with fuzzy hair that wrote the book that said, you have to have 10,000 hours of practice.
Bill Gates.
No.
That's not a
it's
Gates.
not.
Oh no, Malcolm Gladwell.
Malcolm
Malcolm
Gladwell.
He had Gates in his book.
Yeah. So
that's a great book.
you have to practice. You can't play the piano because
Right.
you're creative and you have a great idea. You've got to practice 10,000 hours
Yeah.
before you get really good at something.
Yeah.
Right.
And you have to do that when you're in medicine.
Right.
And if you look at the best doctors, I personally believe, they're at the time that they go into retirement.
Yeah, it's
They're filled with what is really
Yeah.
the most important part, not all the book learning so much as the spiritual connectedness with their patients, the reality that that's important, and the wisdom of all the experience. But I think also that if you're creative, that means that you're coming from no experience, no practice, a new idea. It's no 10,000 hours. So perhaps the best creative person is one who not only has that 10,000 hours on the guitar, but they have the freedom in their mind and that creative process. Maybe both brains are powerful to be able to make a new song.
So in medicine, don't you think we'd be powerful if the institutions and the employers behind a lot of the big groups thought, wow, we have this person with this wisdom and the art of medicine, and we should pair them with this young physician who needs a little more experience but can help them run the computer or can help them with their speed, because they both have those. But we don't really do mentorship in medicine very well.
No, we
need
don't.
to do it better.
We need to do, and you know what? When I was like in my 40s, kind of getting to the point where I think I was really, having passed the point where I thought I knew everything, and I'm now realizing that that all that book learning and what I thought was the truth at this time has changed and so on and so forth. I thought I would love to mentor, to be a student again, and to follow somebody practicing. You kind of have to get to that phase where you realize you don't know everything.
Right.
That's somewhere along the line, maybe after a patient dies or whatever.
Right.
And so my point is, I think exactly right, but we should be doing it all along. Mm-hmm. And that's where CME comes in. We should be having weekly educational conferences that isn't through all of the hoops that we had to go. It got worse and worse and worse, and then it finally died because there were too many hoops. Mm-hmm. And we stopped having our noon meetings with the other doctors talking with each other.
Right.
That's a crisis, I thought.
I agree with you. And the doctor's lounge, right? The doctor's lounge is where we discuss cases. We talk to one another. We're colleagues. We're innovative. We come up and solve problems. And that's been somehow
Gone away.
And the M&M conference.
Yeah.
Yeah.
Morbidity and mortality.
Yeah, that was a lawyer's feast.
Yeah.
Yeah. When they got the papers, that's what they did. So they canceled that.
They canceled
program.
that, too?
When I was in residency, yeah.
What about grapefruit that makes it verboten for most medicine? Grapefruit. What do you think?
Well, it affects the cytochrome P450 system, I believe, in the liver.
Yeah. Could.
I know. Thank you. But so it just makes drugs
More readily
absorbed. Yeah, and so you can get toxic levels of some of the drugs.
Especially if you're on a grapefruit diet, which nobody really should be on a grapefruit diet.
No. So it changes things.
Don't do that.
I like the idea of every day have a glass of grapefruit juice and see what happens with your blood pressure and see if you can cut the dose in half.
Right. Yeah. Viagra.
Viagra, it doubles the
Yeah.
effectiveness of Viagra. Cut the Viagra in half,
There you go.
or more effect. Wow.
AC/DC.
How should we approach the increasing number of patients with impending shortage of doctors?
Oh, yeah, that's a really good question. Yeah.
I think there's some online things. I think there's a lot of telemedicine that could really play into here. Technology can win this
I
with
think
the right
that's really
person.
important, yeah.
I wish Steve Jobs was still alive. I think he could have figured it out.
I have a team that I'm working with Regional Health, and I think that it's interesting with that team. I have 3 MAs or nurses and myself, and we see about 28 to 30 patients a day. And it's a team-based model, and it's interesting to see when I have a consistent team who knows the patients, there's so much prep work and after work that's done by that team that I can go in and do the very specific things. So like I don't work on the computer, the nurse does behind me.
No, you can hold their hand and talk to them and
Exactly.
say Bertha or Martha.
Yeah.
Instead of sitting on a computer
Right.
and
Right.
glancing at the patient every once in a
Right. So part of it's going to be work smarter, right? Telemedicine.
Right.
Yeah.
Right.
Well, I like the new article that the South Dakota Family Practice people just came out with that showed that burnout is much less in rural South Dakota, in rural doctors doing family practice out there, that they have less burnout. And that went national. So the national AFP, what is it, AAFP?
Yeah.
Said, wow, South Dakota, you're right on top of it.
You know what? That has nothing to do with us. That has to do, at least in my community, with our patients. Like several times a day, I mean, at least 50 to 60% of the patients say, "How are you doing?"
Yeah.
How are you doing? Are you okay?
They
How
care
are
for you.
How
Right?
are your twins?
Yeah, I mean,
Why
like,
do you have them so late in life?
I mean, it does.
Your
Why do
dad
you have gray hair now?
reduces burnout when
Yeah, it
people
does,
when
absolutely.
you
people love
share.
you.
Yes, absolutely. Yeah.
How much time do you spend talking to your patients about end-of-life care, nursing home insurance, living wills, durable power of attorney, comfort care? Now, we're running out of time, so we want to finish. We got like 4 questions.
That is probably the best question. And we don't have time. And you know that. We don't have time to do it.
So what I tell people is, let's schedule an appointment for that, because I'll go over it
Right.
quickly with them and say, you know what, I'd really like to sit down with you. I'm going to get an appointment for 30 minutes, just this topic. Let's talk about it.
And
Bring
I-
your daughter, bring
and
your
I-
son.
I push Comfort One, Dr. Ruben Barres.
Yeah.
Yes, I push that. And I give him that and I said, let's talk. Bring your family and let's talk. But in that 15 minutes, 10 minutes, 5 minutes, we don't have time.
I say to them, here's a simple question. If you lose your mental capacity such that you don't recognize your family members, would you like to be kept alive with a feeding tube?
Right.
Talk about that over Thanksgiving dinner, will you?
How's that go for your?
And go around the room. Let every young person, everybody
Yeah.
answer that question. We've got 30 seconds. Referring to the mind-body-spirit connection, what impact does our conditioning or belief systems have on our holistic health? That was interesting.
Yeah, that's deep. It's the basis for it, right? It's the first half, second half of life. Richard Rohr's book is a great book to look at for that.
Wow, that's it. After this short break, please stay tuned for the important takeaway messages from our guests, as well as the answer to tonight's Prairie Doc quiz question.
About 1 in 8 U.S. women, or about 12%, will develop invasive breast cancer over the course of her lifetime. Decades of research have brought us a long way. Breast Cancer Treatment Update. Next time, On Call with the Prairie Doc.
On Call with the Prairie Doc is very important to a lot of people in this area and in this region because it communicates a lot of very valuable information on healthcare. This project takes dollars. We have a great foundation called the Healing Words Foundation that oversees this whole operation and is responsible for some of the fundraising to promote these programs. So the website is prairiedoc.org, O-R-G, prairiedoc.org. Go there, donate if you're so inclined, and we thank you very much.
Welcome back. So first question is, you're teaching us tonight. Who is your most important teacher in medicine, and how did he share what you learned?
He or she shared.
Yes, he or she.
I think my wife is a very important teacher. I mean, she's a neurologist. I met her on 8/8 of '88 at 8 o'clock over my dead body, gross anatomy. I say it all the time. 26 years of marriage, and I've learned so much from her. I love her dearly, and I mean, when I want to talk neurology, she's there. And she's there at 24/7, so I have
At 24/7,
Yeah,
that's a good deal.
It is nice.
Great
so
reference.
she's a great teacher.
Romantic, too.
Yeah, that's a romantic. Yeah. Joy, what would you say is your best teacher?
Mom was always my best teacher. She's through her living and through her death, taught me to be kind and compassionate.
Wow, that's a great answer. And John Barlow was one of my absolute favorite
Agreed.
teachers. He's
Yeah.
in the audience, as was Ruben Barres and many of the people in this room. And we'll have to end it at that. We thank you so much for being on the show. And now for the answer to tonight's Prairie Doc quiz question. In the last 3 years, how many long-term care facilities in South Dakota have had to close their doors due to the lack of a reimbursement by Medicaid? And the answer is 7 so far. Sioux Falls, Huron, Madison, Mobridge, Bryant, Tripp, Rosholt have all closed because we don't pay for the Medicaid patient well enough to keep the doors open for a nursing home. We'll be right back after this.
Have you heard? The Prairie Doc has a radio show. Listen to your local radio station for Prairie Doc Conversations. This program features physicians and other health professionals discussing various medical topics important to you and your family. Ask your local radio station if they broadcast Prairie Doc Conversations.
Thank you for listening. Until next time, stay healthy out there, people. During one of our weekly hospice meetings, the discussion turned to the burden of finding an opening in a facility or a nursing home or an assisted living for one of our patients. Mr. A belongs to the working poor segment of our society, just above official levels of poverty, and yet he cannot afford health insurance and primary care, let alone the private cost of an assisted living center or nursing home. Our patient is still living at home, has no family support, and definitely is in trouble. His progressive cancer has caused an inability even to do activities of daily living such as bowel and bladder care. He now only has Medicaid, and his hospice nurse and social worker are not able to find an assisted living center or a nursing home that will take him. It's no surprise care facilities in South Dakota try to avoid Medicaid patients like Mr. A, because here Medicaid pays so poorly that facilities lose money when caring for them. If a nursing home has too many Medicaid patients, it simply can't stay afloat. This explains why nursing homes, especially in rural areas, are closing. The national solution was to expand Medicaid coverage to increase payments for services using federal dollars. Some states initially elected not to expand Medicaid for fear they would become dependent on this money. However, many states have changed their position, and to date, 36 states now accept the national funding from expanded Medicaid. South Dakota and Wyoming are among the 14 which, so far, do not, but Wyoming is working on it. North Dakota expanded Medicaid in 2014, as did Nebraska this last year. If Medicaid was expanded in South Dakota, more than $2 billion of federal health care funding would come into our state, helping health care coverage to 55,000 South Dakotans, in turn helping to prevent rural nursing homes from closing. Also, this would help Mr. A and people like him get comfort care during their dying days. Medicaid expansion passed last year in some majority Republican states, indicating that this is a bipartisan issue. A recent poll revealed that approximately 80% of South Dakotans want Medicaid expansion. In my opinion, fearing dependence on federal money does not justify letting our rural nursing homes close or letting the working poor go without support. It is time for those within the political arena to expand Medicaid. And a big thank you to our guests, Joy and Kevin, for joining us in the Rapid City studio of South Dakota Public Broadcasting. And thank you also to South Dakota Public Broadcasting for sharing their beautiful West River offices and the great staff here at the studio who have helped us produce our program tonight. If you'd like more information about this program or to see more episodes, please like and follow us on Facebook or visit us at prairiedoc.org. Well, that does it for tonight. From all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call with the Prairie Doc on South Dakota Public Broadcasting. Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota, and with the ongoing support of these individuals and institutions. Brookings Health System, Ophthalmology Limited, Avera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, Vance Thompson Vision, Urology Specialists, Brown Clinic, American Academy of Family Physicians Foundation, and South Dakota Academy of Family Physicians, Black Hills Medical Society, Aberdeen District Medical Society, Brookings Madison Flandreau District Medical Society, Sioux Falls District Medical Society, Dakota Bank, Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, Aberdeen Asthma and Allergy, and Swiftel Communications.